I'm a therapist, and today I'm going to talk about how we can reduce health anxiety. So, illness anxiety disorder or health anxiety is defined by a preoccupation of having some sort of serious illness and being really worried about any physical symptom that we have. Maybe that we worry that a rash is a symptom of something much more dangerous, or that the fact that our heart sometimes races a little bit too much, that we're worried that we have some sort of chronic heart disease. And this preoccupation basically makes us very anxious about our health status and may lead to a couple of different possibilities of either constantly going to doctors and checking up with them, and even though we get sort of evidence that hey, nothing's wrong, and the tests don't show anything, that we can't really believe it, or avoiding all signs or symptoms or searching anything about our health because we're so anxious. So the anxiety can manifest in a couple different ways, and both of these behaviors, whether it's constantly checking our health status, constantly going to the doctors, or completely avoiding anything that has to do with health, both serve a very similar function in that it is a kind of avoidance of the uncertainty of whether or not we're struggling with some sort of serious illness. So the people constantly checking want to kind of reduce their uncertainty about whether or not they're actually struggling with a serious illness, and the people just completely avoiding just don't want to know about it at all, so that kind of reduces their uncertainty by just leaving and getting away from the potential fact that we're struggling with a serious illness. And unsurprisingly, when we're completely preoccupied about whether or not we're struggling with a serious illness and all of our attention and thoughts are about health, that it would be very hard for us to live a valued life and do the things that we know are important to us. So let's talk a little bit about some of the evidence-based strategies that are quite helpful for reducing health anxiety. And as a quick disclaimer, I do want to say that not all of these strategies will necessarily work for you. So I encourage you to listen through, figure out the ones that really resonate with you, that you can give it a shot, and then experiment with them to see if they help reduce your anxiety, even if it's just a bit. So one of the strategies that come from cognitive therapy is checking the facts, where we're basically saying, hey, like I have this thought that, I'm having this sort of heart condition or cancer or something very, very dangerous. At the same time, what are the actual facts that do or don't support this thought? And oftentimes, one of the things that we can do, especially for the people who went to the doctors or, checked their things online, they can kind of gather a fair amount of facts that don't really support the condition. Maybe they were worried about having a heart disease, but the doctor's test came back completely normal. And, there's nothing on the internet except for some obscure reference that really showcases any evidence they're dealing with something serious. So being able to kind of remind themselves that these are kind of the facts associated with the situation can help reduce the intensity of their distress. Alongside directly challenging our thoughts, like in cognitive therapy, another way to deal with thoughts is through more mindfulness and acceptance-based strategies, which is changing our relationship with the thought. That oftentimes when we have a thought as scary as like maybe I have cancer or some sort of serious illness, we take it very real and take it for granted that it might be true. Like we think that thought, there's something special about it, that it must be more right than any of the other thousand arbitrary thoughts that we have on a day-to-day. And mindfulness basically says, hey, wait a minute, this thought is just a thought, and a thought is not fact. And why am I giving so much salience and power to this random thought that just happened to pop up in my mind? It doesn't necessarily mean it's true just because it increases my anxiety or increases kind of like the intensity of my physical sensations. And being able to say, okay, wait a minute, I had this thought, it's over here, and it doesn't really mean anything. Can I allow myself to just let it go and kind of deal with that by changing a relationship with the thought rather than kind of trying to change the thought itself? Another strategy that can be quite helpful is to actually process and confront our fears through journaling. And one of the things this can be helpful for is to actually really write out, what are my catastrophic fears? Like if I actually had cancer, if I actually had this condition, what would I do and what would happen? What are my fears that makes this sort of thought so powerful and so real for me? I'll tell you a story about one of my patients who struggled with panic disorder. So he was often worried about, symptoms of like his heart racing, because he worried that his heart racing meant that he was having a heart attack, or he worried that he had some sort of heart condition. And even though he went to the doctors and they said, hey, like your heart is perfectly fine, he was still really, really worried about it. And as we got better and better at tolerating the anxiety, one of the fun things that he said, which was really silly, but also like really, really powerful, was that, hey, like if I were to have this heart attack, there's a couple possible outcomes. Either I end up being okay and my lease on life completely changes, like my outlook on whether or not I should really prioritize my health will really, really change, and I'll really start taking care of myself, or I'll be dead and I won't have to worry about it. And it was that kind of sort of ability and resilience to deal with the negative consequences in his sort of cognitive capacity that allowed him to not really be worried about having heart attacks down the road, which of course made it less likely for his heart to race and for him to feel a lot better in general. So although you don't have to adopt the same mindset, one thing that can be really helpful is to write down what are the things that you're worried about. What will you lose as a result of having this potential condition? Really face your fears and sit with some of that anxiety, because you might find yourself a little bit more resilient than you think. And alongside that is the lesson of learning to sit with our uncertainty, because uncertainty is always around us. Like, I could be talking right now and for some reason a freak accident might happen and lightning might strike me. Obviously, if I'm still talking, that probably didn't happen, but it is real that, as we kind of go through life, it is very possible for negative things to happen to us. I could go outside right now and potentially be hit by a car, but that doesn't, take me away from necessarily living my own life worth living and following my values. And I think this discussion on values is really important because in a lot of ways, one thing that I think about when I think about health anxiety or anxiety in general and fear of like maybe dying or having something really horrible happening to us is because we feel like we haven't done the things that we feel like we really want to do in this lifetime. And as a result, we feel afraid. We feel afraid of something happening because we feel like we really haven't lived life just yet. So one thing that I encourage to do as part of acceptance and commitment therapy is to say, hey, you know what? I am really afraid right now. Things are uncertain right now. Is there a way that I can still move towards my values? Is it still okay for me to do the things every day that I know are truly meaningful for me? What are my values? What are the things that are important to me? And continue doing those things in spite of the uncertainty. And I think that willingness to sit with the uncertainty and continue moving towards your own life worth living one way or the other is a pathway towards freedom from anxiety. Because if you can say with true genuineness that every day I'm doing the things that matter the most to me, whether it is a certain hobby, certain connections and social relationships, whether it's something else that truly matters to you, if you are doing that every single day, I think you'd be a little bit less anxious about something bad happening because you're not waiting for life to happen. Life is already happening for you, so you can feel content and relaxed knowing that you've done the right things and the things that are important to you. And one final strategy that I think can be really helpful to be able to tolerate uncertainty a little bit more, especially when it comes to related to health anxiety, is to avoid avoiding. As we talked about earlier in this video, that avoidance can come in a couple forms. It can come from like constant reassurance seeking by going to doctors, searching online, or people who like don't look at anything at all and try to avoid anything related to their health. Both of these ways are to reduce the stress in the short term, but maintains our anxiety about health in the long run. So seeing if you can even in some ways like reduce the urge to avoid in one way, shape, or form, and really sit with the sort of feeling and anxiety about what it would mean to struggle with some sort of health condition, and being able to sit with it just for another minute, another couple of minutes. And what we find is that the anxiety isn't something like this where it consistently gets higher and higher, but really it operates more like waves where there's going to ebb and flow in terms of sometimes being a little bit higher, sometimes being a little bit lower. So being able to in some ways change your relationship with anxiety itself can be one way to reduce overall anxiety. And this sounds crazy, but when we think about anxiety, at least in normal levels, is that anxiety is kind of something that protects you. It's like a friend, and in this case of health anxiety or illness anxiety disorder, the friend has become a little bit too overprotective. It's constantly trying to protect you from something more serious. But one thing you can do is to, in some ways, make friends with your anxiety and say, hey, like, thanks for being here. Thanks for your message. I think I'm going to be okay. So you're welcome to maybe relax, take a back seat for a little bit, and I'll see you next time. So as you can see, there's a number of different tools that you can use to reduce health anxiety. I encourage you to, if you're feeling a little bit overwhelmed with what should I choose, what should I do, I would just pick one that feels really right for you to try out. So maybe it's checking the facts, maybe it's, sitting with the anxiety a little bit, maybe it's thinking about what are some things I can do that are meaningful in my life in spite of my fear. Anything can be super helpful, so pick the one that feels right, get started, and I hope you found this video helpful. Anyway, that's all for now. Thanks for watching as always. If you did enjoy the video, I encourage you to subscribe because I'll be continuing to make videos just like this down the road. Take care.